What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.
Well, welcome back, and Hoag Medical Group is with us today, and specifically Dr. Nayak, and it's nice to meet you. Did I pronounce that right?
Yeah, that's
All right. And we were just talking a little bit. She used to be back in Chicago, but has been out in this area for about a year with Hoag. And you are in internal medicine with Hoag Medical Group. And one of the things about internists is that you specialize to a point more than just family medicine, correct?
Yes.
So when people, especially people from this community, come to visit you, you're a little bit more in tune for the needs for that age group, correct?
Yes, that's right.
And one of the things you wanted to go over is an area of interest that we hear a lot about in this community and in general throughout the country now is diabetes.
Yeah.
And it's not uncommon for people one way or another, whether they have one of the two types of diabetes, but to get that disease. And managing it can be quite difficult. However, with the different advances that are out there, it's made to be a lot easier than it used to be, correct?
Yes. So there are about 371 million cases of diabetes throughout the world, and almost like 50% it's undiagnosed.
Wow.
Yeah.
Which can be, well, we know diabetes can lead, if it's undiagnosed, to a lot of problems, including problems with your feet, your eyes, of course, and just a host of other issues, correct?
Yes.
So when someone comes to you and they're first diagnosed with diabetes, what are the things that you discuss with them? That you sit down and you look at their lifestyle or the type of system that you might use, meaning I know they're the different, besides the standard, you used to always take the diabetes, the shots every day. Now there are insulin pumps that somebody can just wear and not worry about that much. I think they beep when they need to be attended to.
So when a patient is diagnosed with diabetes, so diabetes, like there are different types of diabetes, type 1, type 2, and gestational diabetes. So type 2 is a preventable, or they can delay the complications if they are early diagnosed and managed well. So when a patient comes to the office, so the first thing is we have to educate them about the diabetes. And so the physical exercises, the diet, and monitoring the blood glucose at home regularly, which is very, very important, with a glucometer and maintaining a log of the blood glucose level and bringing the machine to the doctor every visit, like with them. And with the medications, taking the medications, there are different types of medications available, oral pills, and as you said, insulin injections, and nowadays it's an insulin pump, which is a lot more easier for the patients. But based on the type of diabetes and the need of the patient, so the healthcare professional will decide what kind of medications the patient should be on. And educating the patient about the foot care, the eye care, the heart care. So all the patients, all the diabetic patients, they should wear comfortable shoes, not too tight or too loose, since the consistent high blood glucose level in the body, it affects the nerve So these nerve damage, it causes tingling or like numbness in the feet. So which eventually they will have loss of sensation. So many of the injuries get unnoticed. So because of the loss of sensation, and so the patients will not know they are injured, and the wounds get infected, and it will lead to amputation. So they might lose the limb. So foot care is very, very important, and at each doctor visit they should get examine their foot. And eye care, so consistent high blood glucose, it affects the eye vessels also, damaging the eye. So it might lead to blindness. So they should have a regular eye checkup like every 2 years with a dilated pupil, not just a routine optometric, like not just a vision testing. So with the dilated pupil, they should get their examined, their eyes. So, and they should also check their heart. They should maintain the blood glucose, the blood pressure, and the cholesterol at or close to normal to prevent or delay these complications. Since diabetes is a #1 cause for the cardiovascular disease, #1 cause for the blindness, #1 cause for the kidney failure, #1 cause for the limb amputation. So all these can be prevented or delayed if the patient takes good care of their blood, like health.
You mentioned the machine that's used. Now you're talking about the one where you do
Check
a
the-
fingerprint
yes.
prick every, I don't know how many times you do that a day. You prick your finger, and now of course, now they have the little strips that pop out.
Yes.
And do they record that information?
Yeah, so the
Okay.
glucometer, it records the information, and most of the patients, like commonly, like what mistakes they do is they just wake up in the morning and they just check the fasting blood sugar, and that's one prick a day.
Right.
But this is not the way to do. So we need to, when they bring the glucometer to the doctor, so we need to know the blood sugar level throughout the day. So it's not just checking the fasting blood sugar. So one day if they check the fasting blood sugar, so next day they have to check the postprandial, like after food, 1.5 to 2 hours after food, and then before lunch, after lunch, evening, before dinner, after dinner, and
Wow.
1 midnight. So we will know like now how the blood glucose level is spread through the day, and based on that we can adjust the medication. So just checking one blood sugar, like fasting blood sugar in the morning, will not help to manage the patient like perfectly.
Now, do they have to do all those checks on a daily basis, or do that for a certain length of time? They come in and see you, and once you can adjust that, can they go back to just doing that once a day, or do they have to do that many times continually?
No, once a day is perfect. If it is out of control, then we tell the patients to do multiple times.
Okay.
Otherwise, if it's normal, then once a day is enough.
You mentioned the two types of diabetes, type 1 and type 2.
Type 2,
And if someone does have type 1, is that something that's genetic, something that's in them that they're born with and
Yes.
manifests itself? Well, even can, in a small child can have it.
Yes. So type 1 diabetes, which is previously known as juvenile onset diabetes, but now it can occur at any age. So type 1 diabetes, it occurs due to autoimmune process. That means our body's own defense system, it attacks our own cells in the pancreas, destroying them, so which leads to little or no insulin in the body. So, so many research have been conducted to find the cause of this, but many environmental factors and viral infections have been linked to the cause of the type 1 diabetes, and this is not preventable. But type 2 diabetes can be prevented if the all the people or the patients, they follow the healthy diet, physical activity, and exercise, stop smoking, and take care of their health. So then type 2 diabetes can be prevented.
Can type 2, if it's caught in time, can
Yes.
it be reversed?
Most of the patients, by the time they're diagnosed with type 2 diabetes, they have this disease for a while. And so they have the complications by the time they are diagnosed. So there is a test called impaired glucose tolerance test, or impaired fasting test. So this is called pre-diabetes. So if we catch these patients at the pre-diabetic stage, then we can reverse it, or we can delay the onset of the diabetes.
How would you determine who would you test for being pre-diabetic? Is it their lifestyle you talk to? You have two different patients come in, and which one are you going to determine, yeah, we need to do this test, and the other one, no, we don't need to do this at this point?
Okay. So there are several risk factors. So as I said, type 1 diabetes, it cannot be prevented, but we can prevent type 2 diabetes. So there are several risk factors which can cause type 2 diabetes, being overweight, obese. That's
Okay.
a risk factor. And having a family history of diabetes,
Okay.
that's another risk factor. And increasing age is a risk factor. High blood pressure is a risk factor. And following unhealthy diet and lack of activity is a risk factor. And having diabetes during pregnancy, that is called gestational diabetes, that's a risk factor. And impaired glucose tolerance, that is impaired glucose tolerance, it's a blood glucose level where it's above the normal, but it's below the threshold for the diabetic criteria. So these are all the several risk factors for the diabetes.
Okay, very good. It's, I can see it can get a little complicated, but the main thing is that someone comes in and sees someone like you, and obviously if you're seeing them for the first time, you're going to take a family history and
Yes.
go over all the things that you normally would during a general physical, and then from there be able to determine should this test be taken.
Yes.
And if people are interested in speaking with Dr. Nayak, you can get a hold of her. Here's the Hoag Medical Group number on the screen, 949-791-3101, which you are part of, the Hoag Medical Group. So from that point, they can contact Hoag, and if they're interested in finding a new internist for some reason, they can get a hold of you.
Yes. So Hoag Medical Group, we are a group of doctors with different specialty like internal medicine, family practice, pediatric, HIV medicine, vascular medicine. So I work with Hoag as an internist. My office is in Irvine, and with a special interest in diabetes. And our mission is to give good quality care for the patient and serve the community. And I would love to serve the community and take care of the diabetic patients as well.
All right, and Hoag has a very good reputation in general throughout Orange County. So you can also go on to hoagmedicalgroup.com for more information on that. Doctor, it's been a pleasure. A lot of good information.
Thank you.
Thank you for coming on.
Thank you for calling us and giving an opportunity.
Great.
Thank
Folks,
you.
we'll be back in just a moment.
What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.